The goal of sex is to play, have fun, have pleasure. If you're achieving that and you're happy with it, that's what should really matter. Of course, no one's ever talked to me about it, so I don't think I can bring it up. And so you develop shame, you develop stress around sex, you develop stress around your partners, and you're like, well, it's just easier to watch pornography rather than deal with all that shame and stress. I think porn has problems, so I think that it's freely available, which is really harmful to young people because kids are seeing it now at younger ages.
10.
And so what that means then is that some kids younger than 10 are seeing it. And so that's really scary. You don't know what to do with that when you're that age.
Right.
And most parents are not having a discussion with their kids. So that is really scary because your brain's not fully developed. You're learning what sex is from a movie, a production that is not meant to replicate real life. And so it can become really problematic, especially for young people.
Yeah.
And the fact that it's so freely available is scary.
All right, guys, Rena Malik here today, sex expert. Thanks for coming on.
Thanks for having me.
This stuff is necessary to talk about, right?
Absolutely.
Yeah, I remember growing up, there was a lot of shame to discuss these topics, but now it's more accepted.
I don't know if it's more accepted, but we're talking about it.
Yeah, you probably still get some backlash, right?
Yeah, I mean, I think people are uncomfortable, right? And they have very strong feelings one way or the other. Right. So it can be positive and it can be negative. But at the end of the day, we deserve to know about our bodies and we deserve to know how they function. And that's, I think, a basic human right.
What are the biggest problems you're seeing right now?
I think it's really lack of unclear expectations of what should normally happen in the bedroom, right? Where people think that they should be having sex all night long or that their organs should look a certain way or they should be responding in a certain way, which then leads to shame, which then leads to downstream consequences of shame.
Yeah, there are some people that think it should last like an hour, right?
Mm-hmm. Yeah.
It's pretty long, I guess.
Well, at least from scientifically, when we do look at research studies on the amount of time sex lasts, it's usually the amount of time penetration, right? From insertion to climax,
right?
Typically with a male climaxing. And so that time is quite low. It's about, on average, 5.5 minutes. But that's not all sex is, right? Sex is foreplay, and it can include oral, manual, whatever, anal stimulation. It can all be included in what sex is. So it can last hours or however long you want it to be. I mean, foreplay can start in the morning.
Yeah.
But I think the actual act of sex and how long that should last, specifically penetrative penis and vagina sex, like that is, not that long, and that's okay. The goal of sex is to play, have fun, have pleasure. And if you're achieving that and you're happy with it, that's what should really matter.
Right. 5.5 is longer than I thought it'd be.
Yeah?
Yeah.
5.5 minutes?
I got some work to do. Damn. I think I'm definitely under that.
Yeah. Well,
I wonder if there's techniques to last longer,
There are. So there are. I mean, premature ejaculation is like a real clinical diagnosis. It's diagnosed as, typically if you have your whole life, it's like less than a minute. If it's meaning getting it later in life, it's usually significantly shorter than you used to be. But at the end of the day, it doesn't matter what the clinical diagnosis is. It matters if you're happy with the duration and your partner's happy, right?
Yeah.
If you both are happy with the duration, that's what matters. And if you want to last longer, there are techniques. There are sort of things that we'll prescribe, like stop and start techniques. So you get close to climax, your partner or you squeeze the head of the penis, you wait, and then you do that again till you get close, and you do that 3 times, and on the 4th time, you allow yourself to climax, and sort of kind of like what people call edging. And so you do that, and then slowly over time, you can increase the duration of lasting longer.
Got it.
And then, there's sort of a lot of relaxing of your nervous system that can help. So it's sort of a balance of parasympathetic and sympathetic, the two parts of your nervous system. So when you're ejaculating, very typically people are really revved up, right? But the ability to get an erection and to maintain an erection is a parasympathetic system, which is like a relaxation. You need to be relaxed in the moment. And so if you're getting anxious or stressed about how quickly you're going to climax, you're going to climax quickly.
Right.
So sometimes doing breathing techniques or even techniques out of the bedroom, like doing high intensity interval training. They did a study where they did 7 minutes of high intensity interval training for 2 weeks. So every day for 2 weeks. And they saw people had an increased time of intra-ejaculatory latency time, which is essentially the time that it takes for the for penetration till climax.
Oh, really?
And so that's the theory, is because one, you're more focused during those high intensity intervals. So you're getting used to where your body is in space. And you're also learning sort of your bodily cues. So that education that you're having during those high intensity interval training is then translating to the bedroom.
I could see that because I used to be a runner.
Mm-hmm. Yeah, and there's data on running too. So running can help, yoga can help. The more you do it, the potentially the more benefit you'll see. But yeah, anything where you're sort of understanding where your body is in space and time can help.
Yeah. There's a big attack on the industry right now. I'm sure you're seeing that. Where do you stand on that whole debate?
I think has problems, and I think some people use safely. So I think that it's freely available, which is really harmful to young people because kids are seeing it now at younger ages. So the average age.
The Tri-Light from Therisage is no joke. Medical grade red and near infrared light with 3 frequencies per light. Deep healing, real results, and totally portable. It's legit. Photo biomodulation tech in a flexible on-body panel. This is the Tri-Light from Therisage, and it's next level red light therapy. It's got 118 high-powered polychromatic lights, each delivering 3 healing frequencies, red and near infrared, from 580 to 980 nanometers. It's sleek, portable, and honestly, I don't go anywhere without it.
That a kid sees is around 10.
No.
Yeah.
That's
10.
crazy.
10 or 11. And so what that means then is that some kids younger than 10 are seeing it because that's average. And so that's really scary, right? You don't know what to do with that when you're that age. And most parents are not having a discussion with their kids like, hey, you might see something. Feel free to ask me about it. Let's talk about it. So they're prepared, or at least can have someone they feel comfortable to talk to about it. So that is really scary because your brain's not fully developed. You're learning what sex is from a movie, a production that is not meant to replicate real life. So then when you do have sex, you're like, my body's not responding the same way. My partner's not responding the same way. And now something's wrong with me. And I haven't talked to anyone about it because, of course, no one's ever talked to me about it. So I don't think I can bring it up.
Right.
And so you develop shame. You develop stress around sex. You develop stress around your partners. And then you're like, well, it's just easier to watch pornography, right? Rather than deal with all that shame and stress. And so it can become really problematic, especially for young people.
Yeah.
And the fact that it's so freely available is scary, right? Like when I was younger, you had to find a magazine hidden somewhere, or you had to find a VCR and you had to put a tape in the VCR, and there was no one around in the room. Like it was a challenge to get access to it. And now it's just readily available, and it's becoming more and more varied in terms of what's being shown, more aggressive, potentially more sort of just, it's more sort of intense in what they're showing. And again, they're just trying to get a reaction out of the person watching.
Right.
And so there's a lot of concern there. But I do know that some people watch it without a problem. They use it for pleasure. They may watch it with their partner. They may enjoy that. They don't have a problem with it. But I find that more in older people because they didn't have this free access that young people do today.
10 is mind-blowing to me.
Yeah.
Can you even get a boner at that age? That is so young.
Well, you get boners in utero. So yeah, you can get boners.
Yeah, I also see it affecting older people though, like that are dating, like partners.
Yeah, I mean, I think part of it is if you're single and you're using pornography as the only way to self-pleasure, right? If you're using that as a way to masturbate, not fantasizing, not using your own brain, then you become maybe habituated to that particular visual, which you can't replicate in real life.
Right.
And so it can be a problem in those scenarios too.
Yeah, I've cut it cold turkey, but I know some people that can balance it.
Yeah, I think it's very individual. There's a lot of individual thought about what is, and like the way your relationship to is can really reflect how you feel after you use it, right? So if you think it's bad, when you use it, you're going to feel bad.
Yeah.
But if you think it's okay and it's not a bad thing, you may be able to develop a healthy relationship and use it for pleasure.
Yeah. Are you seeing women watching it? I know there used to be a lot of shame around that, right?
Yeah, there's absolutely women watching it. I think there's a tendency for women to read more erotic literature, but definitely women are watching pornography and seeing it and using it.
Okay. Yeah, because when I was growing up, no one would admit it. Like,
Yeah, I mean, I think still it's stigmatized, right? Like, I think it's interesting. We know the stats. Almost everyone has seen or participates in watching. A lot of people do, the large majority. But the second you talk about pornography, everyone's condemning it. And it's easy to say that, but behind closed doors, a lot of people are still participating in it.
right. What do you get asked the most from your clients, I guess?
I think, more so it's my patients will see me for actual medical issues, like, how to get stronger erections, how to improve their desire. Those are probably the two most common things I see from men and women respective.
Got it. And are you seeing more ED cases in younger people these days?
Absolutely. A lot more than I used to. And I think part of it is this exposure to pornography and then feeling like, one, they're not performing as the actors do on pornography, and that can play a huge toll. And the first time you have a problem with an erection, that is a problem for you, right? Because the next time you try to have an erection, you're thinking about it. You're like, am I going to actually be able to have an erection and make my partner feel good? And so instead of being in the moment, you're catastrophizing. And then of course you don't get an erection because stress is a killer of all good things. And then you don't have it again and you're like, oh my God, I'm broken. Something's wrong with me. And now I have a problem.
Right.
So there are still absolutely medical organic reasons that people get ED even at young ages. But more commonly, it's a lot of this psychogenic stress-related issues.
And have you seen a link with testosterone and ED?
Yeah, so interestingly, a lot of people think, oh, if I have ED, it's because of testosterone. But only about 3 to 6% of erectile dysfunction is only due to testosterone. Now, certainly...
Shout out to today's sponsor, Quince. As the weather cools, I'm swapping in the pieces that actually gets the job done, that are warm, durable, and built to last. Quince delivers every time with wardrobe staples that'll carry you through the season. They have fall staples that you'll actually want to wear, like the 100% Mongolian cashmere for just $60. They also got classic fit denim and real leather and wool outerwear that looks sharp and holds up. By partnering directly with ethical factories and top artisans, Quince cuts out the middleman to deliver premium quality at half the cost of similar brands. They've really become a go-to across the board. You guys know how I love linen and how I've talked about it on previous episodes. I picked up some linen pants and they feel incredible. The quality is definitely noticeable compared to other brands. Layer up this fall with pieces that feel as good as they look. Go to quince.com/DSH for free shipping on your order and 365-day returns. They're also available in Canada too.
If someone has ED and I give them testosterone because they have low testosterone, they're going to see somewhat of an improvement. They may see more nighttime erections. They may even get better erections, but oftentimes that's not the only cause of erectile dysfunction.
Right. Yeah, because people associate low testosterone with low sex drive, though, right?
Absolutely, and that's true. We definitely see low sex drive in men and women who have low testosterone. But, sex drive is so complex. So you have to look at the whole picture. Like, is their whole hormonal milieu intact? Like, their thyroid's working okay? How's their relationship? How's stress? How's sleep? The whole picture plays a role in sex drive.
Right. What do you think of the upcoming movement, No Fap November, coming in a
Yeah,
week?
so I think that there's no medical reason to do it, right? There's one small study where 10 guys abstained for 21 days and they saw a small improvement in their testosterone numbers. Now, does that mean that if you abstain for a whole month, you're going to have this crazy high level of testosterone? No, not necessarily. And also it's never been replicated. And also there's no physiologic changes, right? So if you abstain from ejaculating, your body is either going to take care of it by absorbing the semen or you're going to have a wet dream. So if you have a wet dream, your body just takes care of it. And then the issue is that some people start feeling really shameful. Like, oh, I had a wet dream. I messed up No Nut November. And now I'm dealing with all this shame. Or they're clenching their pelvic floor so tightly because they're trying to hold back every time they, feel some urge that they develop what's called pelvic floor dysfunction. And then they get all these issues like pain with erections, pain with ejaculation, constipation, urinary issues, a whole host of things that now starts happening because they've tried to abstain, but they can't.
I'd be curious to see a medical study on people that do semen retention because they do it even longer than a month.
Yeah, and I think, like, again, I don't think there's a harm in it. A lot of people report they have these great benefits. They're more focused. They have more energy. They feel great. When they do have sex, eventually it's even better. And I think that's fine as long as you're not harming yourself, right? As long as you're not, like, clenching your pelvic floor so tight that you're having all these issues or that you're having a lot of shame because of your wet dreams. I think it's fine. And if you see those benefits, by all means, I think there's definitely people who use it for spiritual benefits, like they feel closer to God or whatever. And that's great. Like if they feel that, I don't think there's any harm in it. I don't think you have to ejaculate a certain number of times, to be healthy.
Yeah, there's no like set number, right?
Yeah,
Everyone always asks how often should I have sex?
Yeah, I mean, so the only number in the data that we know is like there was one study that looked at prostate cancer and the number of ejaculations per month. And what they found was that men who ejaculated 21 times or more per month had a lower risk of prostate cancer than guys who ejaculated less than 7 times.
Oh, wow.
But, that's one study. The theory is maybe there's less fluid that's stagnant in those tissues that might then develop carcinogens and, changes that cause cancer. But again, I think, and the ejaculation sort of cleans the pipes. But I think ultimately, like I don't think that's enough reason to say everyone needs to masturbate or have sex 21 times a month, right?
That's a lot.
Yeah. I think,
that's almost daily.
Most people are having sex on average once a week.
Yeah.
If you're younger, maybe a little more than that. And if you're older, like in your 60s, maybe a little less than that, but that's what the averages are. And again, it doesn't matter if you have sex every day or every week, as long as you're enjoying sex, right? Like you're happy, your partner's happy, there's no conflict. Like that's what really matters.
Absolutely. Are you seeing an increase in infertility issues?
Yeah, I mean, we're definitely seeing, the thing is, I think most of the time there's a male and a female infertility issue. For the male infertility issue, oftentimes because women are waiting longer to get pregnant, they're actually going to their female reproductive endocrinologist before they see their urologist. And so because they have to go through that anyways, it becomes less of an issue as a urologist. But yeah, we definitely see people with infertility. And I think because we're seeing declines in testosterone and more exposure to things in our environment, potentially we are seeing a little bit of an increase in infertility.
Yeah.
But, I think ultimately we're also seeing more comorbid conditions. People are unhealthier, right? They're eating more, they're not moving as much, and that will affect everything in your body, including your health of your sperm.
Right. I've seen some crazy studies, but I don't know if they're true. It's like 30% of people are virgins, like under 25 or something, 18 to 25.
Yeah, I don't know if that's true either. I haven't looked into that, but I would say we definitely saw an increase in abstinence from sex during COVID, which makes sense. Will that continue? I'm not sure. I think there are some people who will quote that, the younger generation is more comfortable talking about their needs and desires compared to the older generation. So they can tell their partner, hey, I like this, I don't like this. And so they're more open to having casual sex. So maybe that will not stay the same.
Yeah. Were you doing the content before your practice, or which one happened first, I guess?
No, I started practicing before I started making content.
Okay. And the content helped the business out a lot?
The content was really out of a desire to educate people. Like I was seeing patients every day and they would have questions, and I realized like they just spent so much time waiting in the waiting room, getting a parking spot, coming to see me, and they could just learn some of this stuff at home. And so I started making content really to provide education to people. I never expected it to grow like it did. I just realized that sexual education in our country and around the world sucks. And like people deserve and need access to high quality evidence-based information.
How do you feel about it being taught in school? Because I remember my sex ed class, we all just laughed. Like no one took it serious.
Yeah, I mean, I think some good things are taught, right? Like in most schools, you're learning about condom use, you're learning about consent, you're learning about STD prevention. So those things are important, but there's just not enough, right? Yeah. And there's not enough time in the school year to dedicate to sexual health. But I think that, kids don't know their anatomy, right? You see those like guy on the street questions, like where's the clitoris, and no one knows where it is, right? Yeah. And so like we need to know your own body, you need to know what your partner's body is like, what's normal, and I think that would create so much sex positivity, comfort in your own body, and the ability to pleasure yourself and others. I mean, think about how much stress people have every single day when they're having issues in the bedroom.
Right.
They're not talking about it, but they're feeling it.
Oh, for sure. Yeah. They're going to work the next day with that.
Yeah. And they're thinking about it, and they're stressed and they feel miserable.
Yeah. Some men don't even know they have a G-spot.
Yes, yes. And some men feel very uncomfortable stimulating their area. So the G spot is actually the P spot. The prostate can be very erotic to some men, but a lot of men don't get that area stimulated because they feel uncomfortable. And so they don't know that. And then there's a lot of information about the G spot, but people don't know what that is either for women. The G spot is actually a zone. It's about 2 to 3 centimeters in the vagina at the top side, so underneath where the pee comes out. And that's an area where there's a lot of nerve endings that come together, as well as some glands called the Skene's glands. And so they're anatomically very similar to the prostate. And so stimulating that area can be pleasurable for women and for men, but it's not necessarily the only way to reach climax.
Right. Man, men must get intimidated when they're hooking up with you.
Well, I'm married, so I only hook up with one person.
Yeah, I would be. If there's a lot of females that teach this stuff that I bet men would be like nervous, you know?
Yeah, but I think people who talk about sex are comfortable talking to their partners about things and being open about it.
Yeah.
That's the whole thing.
That's important.
You just gotta to ask your partner what they're into and be open to like learning.
Yeah, I feel like a lot of people aren't taking that step, right?
Yeah, they're just like going into it and doing what they see on TV, or on in today's day, and like that's not necessarily what everyone likes.
Right, and also like people compare themselves. Right.
Exactly. There's a lot of comparison, and you realize like these actors, they're chosen to be actors, or they've chosen to be actors in pornography for a reason. They're genetically gifted, or they, have certain attributes that make them more likely to succeed in the industry.
Yeah. Have you seen the size matter at all with women?
So generally speaking, the clitoris is the most reliable route for orgasm for women. So you don't need to penetrate to stimulate the clitoris, right? You can do manual stimulation, oral stimulation. And so for most women, as long as they're having a climax, that's really the most important thing. Now, there are some women who tend to prefer having a longer phallus because they get a lot of pleasure from cervical stimulation, which is at the very top of the vagina, but that's a small subset. Most women generally are on average, their vagina is about 3 to 4 inches in length. And so the average penis is about 5.1 to 5.5 inches. And so the vagina will widen and lengthen to prepare for penetration. And so most people are going to fit, right? Average is going to fit average.
Right.
And so you want someone who's going to fit. Otherwise, if you're too big, it can actually be uncomfortable.
Right. Oh, I didn't know it was only 3 to 4 inches. That's way less than I thought it'd be.
Yeah, I mean, it does expand, right? And everyone's degree of expansion is different, but it can expand, 2 or 3 inches when it's fully aroused. So that's why it's really important to make sure if you're a male and you're pleasuring a female, that you give her sufficient time to become aroused before you penetrate, so that it's not uncomfortable.
Yeah. How do you feel about Viagra and this one company, Blue Chew? They sponsor a lot of shows. How do you feel about taking stuff like that?
I think if you need it, it's absolutely a wonderful medication that can help you with confidence. It can help blood flow to the genitals. And I think it's transformed sexual medicine for men in a lot of ways. So I think if you need it, absolutely. If you're having trouble, I often will even prescribe like a low dose of daily Cialis or Tadalafil, because then it takes the spontaneity back into it, right? You don't have to remember to take it. You don't have to remember not to eat a meal. Like, you just take it every day. And then when you need it, it's there for you.
Got it. Yeah, I'm more of the holistic side. So that's probably where we differ. But yeah, I guess if you can't fix it naturally, then something like that could help.
I think there's, diet, exercise, those things are going to be the pillars of your health, making sure you don't get blood pressure issues, you don't get diabetes, you maintain good cholesterol. Those things are going to be paramount to maintaining your erection. So those first and foremost, always. And then if despite doing those things and maintaining your health, you're still struggling, I think it can be a big help for a lot of people.
Yeah. Is that a genetic thing if people struggle with that?
Some and some lifestyle, right? Like if you have bad cholesterol from your diet, or you get diabetes from diet and lack of movement, we see a lot of that. That's not necessarily all genetic. Certainly you can be predisposed. Like South Asians like me, we have high rates of diabetes and high blood pressure in our communities. And so it's really important for us to maintain good health, whereas somebody else may be able to not work out and still have great cholesterol and never get an issue in their life.
Yeah. You made a few videos about dribble.
Yeah.
And I got to figure out what causes that, because that's
a few things. Yeah. Urinary dribble is very, very common. And there's a few reasons. So one, in older guys, oftentimes it's because of an enlarged prostate. So when you have an enlarged prostate, which is the organ that is underneath the bladder, that is around the urethra or the P tube, then that can block the flow of urine sometimes, but also some urine can get left behind after you urinate. So then when you're done, you think you're done, some more can dribble out. Other times it can be because you have maybe a narrowing. That's less common, but sometimes if there's a narrowing in the urethra, you might notice some post-void dribbles, what we call it. Sometimes it can be because as you age, the muscles around the urethra weaken, and so they're not, getting the urine out quite as efficiently as you once would. And so sometimes people can even sort of milk their urine out after to just get that little bit out. And so, yeah, it's a real common issue, and it can be really annoying for a lot of guys because nobody wants to deal with that. But sometimes if you have some of these issues, treating it with medication or even just, like I said, pushing on the perineum or underneath the scrotum can be helpful to get that little bit of urine out.
Good to know. Yeah, that's one of those things you don't want to tell your boys about.
Yeah, I don't think anyone. This is the issue. Guys don't talk about anything, right? They're not talking about their genitals or their erections with their boys, right?
Yeah.
So it doesn't happen.
Yeah. Have you seen anything work to increase size or girth?
So there are many studies looking at for size surgeries and vacuum erection devices, traction devices. There's no supplement or pill that's going to do any of that. So if something is telling you eat this or drink this and you're going to increase in size, it's not going to work. Mm-hmm. There are some easy things you can do, like certainly shave your pubic hair will make it appear longer. If you lose weight, if you're overweight, some of the weight that's on the mons will reduce, and then you'll be able to see more of your penis because the erectile tissue actually goes deep into the penis, into the pelvis, and then down. So there's a lot of erectile tissue. You're only seeing about half of it. And then, so those are sort of easy things you can do. For some people, when they get anxious, they have a really significant response where they sort of get smaller. And so, working on anxiety can be helpful. But then in terms of non-surgical things, the only thing that I've seen that has some reasonable data is a traction device, which is a device you put on the penis and it sort of just stretches the penis over time. And so you do that for I think the studies were 6 hours a day for weeks, and then you'll see a 2 centimeter increase in length.
Oh, that's it.
Now there's some protocols that are 30 minutes twice a day, which are more manageable, that have also seen around the same amount of increase. So it's not going to be this crazy increase. Some people will report that they notice an increase with vacuum erection devices or penis pumps. However, that's not been shown in the literature. But again, we don't have a ton of research on that, right? No one's going around studying this aggressively. There's surgeries, but there's very high complication rates with a lot of the surgeries that are available. So definitely go to someone who's doing a lot of those surgeries if you really decide to do one, and realize that you only have one penis, and if it gets messed up, there's there's not a lot going back. So I really don't recommend it. In terms of girth, there are lots of things that people have injected in their penis.
Whoa.
And I would say the only safe product that has some reasonable data is hyaluronic acid, which is the same thing women use for fillers in their face. If you do micro amounts or small amounts of filler over time, you can see an increase in girth safely without it getting sort of dysmorphic or lumpy bumpy, basically. So those are safe, I think, knowing the risks and benefits, obviously. And I would say just do whatever you do with caution. And I think especially when you're telling a guy to do something, don't go overboard. People you say do traction, they'll be pulling on it so aggressively. Then you can get nerve injuries and other problems. Just sort of be patient, follow the basic instructions if you're going to do something, and I think more importantly, why do you want to do it, and what do you feel like you're going to gain from it? And certainly small penis anxiety is a real thing, and so if you're feeling that, then you probably need to talk to somebody about it and really deal with your thoughts around it first. And if you still have issues, then absolutely, it's a free country, you should do what you feel is best for you as long as you're well informed.
Yeah, I didn't know small penis anxiety existed. That's interesting.
Yeah, it's a real thing. In fact, more guys, if you on surveys, would rather have a longer penis than be taller.
Wow.
Yeah.
Wow. I don't know. I'm tall and
you're tall.
Yeah, so I don't know if I'd give that up because I've actually experienced it. It's hard to like experience that if you haven't, right?
Right. But you can imagine someone who's shorter in height, they would struggle as a man, right? Potentially, right. Not always, but like they may perceive some struggles. Yeah. And so it's interesting that someone who like, because most guys are not your height, right? Mm-hmm. Most guys are average. And so I think the average person would choose to be taller if you asked them if they had an option. And the average person would also choose to have a longer penis if you asked them. But I think, again, like if you think about it in proportion, you're seeing more people would desire a longer penis than.
Wow. Yeah, I guess, it limits your dating pool if you're shorter as a guy, right?
Yeah, I mean, most women want to date a taller person.
Right.
Again, not all, but certainly the majority.
Yeah, a lot of the ones I meet for sure. Have you looked into stem cells at all? Because I've heard some crazy stories with that.
Yeah, so there's very for erections, I'm imagining you're asking. Yeah. So there's a few studies. They're still really immature in terms of like, are they really effective, right? Because what stem cells are you using? How much stem cell are you using? Are they really going to work? I mean, maybe in the future we'll have some really clear evidence on stem cells causing an improvement in erectile function. That would be great. But right now, I don't think there's enough to say like this is the exact amount of stem cell, the kind of stem cell you need to see results.
Right. Should penises have a curve?
So a lot of penises do. So if you look at the data, like the large majority of penises have some degree of curvature, whether it's like 5 to 15 degrees. But you can get a condition where your penis was, maybe whatever it is, straight or close to straight, and then you develop a curve. And that is usually due to a plaque in the penis called Peyronie's disease. Mm. And this is not dangerous. It's not cancer. It's not going to kill you in any way, shape, or form. It's not going to harm you. But it certainly takes a huge toll emotionally on a man, right? When they wake up one day and they're like, oh my God, my penis has changed, right? And 2, it can make sex sometimes a little bit hard, right? Difficult, because you can't angle a certain way or you can't penetrate. And so there are, treatments we can offer for those sorts of things. But it's not dangerous. It's not harmful. And so if you're okay with it, it's not something you have to do anything about.
Yeah, that's good to know. How many men are showers versus growers, you think?
So there are when you're younger, you're much more of a grower because your tissues are more elastic, and so they can certainly expand more when you get an erection. But some people are showers and some people are growers. There's certainly data to support that those things do exist, and you don't need data. You can tell, right, that this does happen. And again, it's really a matter of the flexibility of the tissues. It could be genetic, like how much collagen and sort of you naturally make in your body. Those sorts of things will play a role in that.
We've talked a lot about men. What about women? What are they struggling with?
A lot of women struggle with low libido, or like having less desire or change in desire over a lifetime. And that's often because as you particularly in longer term relationships and you have more responsibilities in life, you start developing what's called responsive desire. So before, you see your partner, you want to jump them, you want to have sex, you just go, you go for it. And then as you age, that spontaneous desire doesn't come, but you get what's called responsive desire. So like maybe you're with your partner, maybe you're touching each other and you're like, oh yeah, oh, I do like this. Like, oh yeah, I remember I used to like this. And then you're like, oh yeah, I'm enjoying myself.
Yeah.
But it sort of takes a minute. It's like when you go to the gym, you never really want to go, but when you're there, you're glad you did. It's sort of the same thing. And so that becomes very common and people start feeling like something's wrong with them because they're like, oh, what happened to me, right? I used to have this great sex drive and now I don't anymore. There's a lot of, insecurities in general. So body image insecurities are very common for women. Women are worried about the smell of their discharge or things like that, which is very often just normal smell. And they've been convinced by society that they should smell like a pina colada or key lime pie or something, which is not normal, right? So I think those are probably the most common things. And I think we know that, younger women will have a little bit more insecurity, and as women age, they start becoming much more comfortable in their bodies, and they have better sex lives because of it.
I could see that, yeah, because you hear with marriages, the sex goes down every year or something.
Yeah, again, I think that's a sign of like the changes in desire, and obviously there's hormonal changes. Women go through perimenopause and menopause, and so they can have hormonal changes which can affect their desire.
Right. Yeah, for sure. Well, Rena, it's been awesome. Where can people keep up with you?
They can find me. I have my own podcast, the Rena Malik MD podcast, or on YouTube, or really any social media platform at Rena Malik MD.
Perfect. We'll link below. Thanks for coming on.
Thanks for having me.
Yeah, thanks for watching, guys. See you next time. Wherever you guys are watching this show, I would truly appreciate it if you follow or subscribe. It helps a lot with the algorithm. It helps us get bigger and better guests, and it helps us grow the team. Truly means a lot. Thank you guys for supporting, and here's the episode.